it is really my honor to introduce to you Dr. Rob Stone.
So this morning, some of us went to the annual shareholders meeting at Anthem WellPoint, and several of us spoke at that meeting. We were given a chance to speak. I'm not sure we were listened to, but we were given a chance to speak. And I told them that it looks to me like the for-profit health insurance industry is the greatest single barrier to real health care reform in this country today. And I suggested to them that Anthem WellPoint, that used to be known as Blue Cross Blue Shield, the largest health insurance company in the United States today, that they go back to their Blue Cross Blue Shield roots, that they re-mutualize, that they go back to not-for-profit. Because, you know, their job as a for-profit, as a profit-seeking company, is they've got to seek profit in order to support their shareholders and their executives. Their job is not to take care of the people with their policies. Their job, and it's the law, their job is to take care of their shareholders. And how do they make a profit? You know, how does a for-profit insurance company make a profit? Well, they take in money from healthy people. You know, they take in the premiums. And then, in order to make a profit, they've got to figure out, with all their ingenuity, with all their skill, with all their computers, with all their top brass, they've got to figure out how not to pay money out so they can have a profit at the end of the year. That's how they work. I mean, it's what they have to do. They have to figure out, with all their ingenuity, how to deny people coverage who might get sick, so not even cover them in the first place, how to not cover anything once you get sick, when you send in the bill and they say claim denied, and then sometimes they even take people who have coverage who then get sick and they just cancel their policy completely. You know, 6,000 of those cases happened in California last year. Now, so they make their money. Their purpose to exist, the way they make their profit, is by not paying money out for sick people. I went to medical school to take care of sick people. So that's why I find myself diametrically opposed to their entire mission. Now, when I was in high school, I went to church camp, and I learned a song, some of you will know. It was a folk song, spiritual, called All My Trials, Lord. And the stanza of that song that still stands bold in my mind is when it goes, I'm not going to try to sing it for you. If religion were a thing that money could buy, then the rich would live and the poor would die. And that's the healthcare system we've got right now. The rich live, the poor die, and it's not good for the rich or the poor. So what do? Where do we go from here? I need all of your help. I need everybody here. I need your help. Because we can't just sit by and let this healthcare reform debate happen without our voices being heard. And you heard a little bit about how they're trying to cut our voices out. You know, some people cynically say that we've got in America the best democracy that money can buy. I think in Indiana, we proved that a little bit differently in the election last November. you know? People can still raise their voices. People can still be heard. But they're going to outspend us 10 to 1, 100 to 1, 1,000 to 1. But we've got people behind us, and the polls show that we've got support, but we're going to have to speak up. You can't just sit back and say, oh, President Obama's a good guy, and he's going to take care of it. And that's not going to be enough. You're going to need to find your voice. You're going to need to speak up. You're going to need to educate yourselves a little bit, because this is a complicated issue. You know, you can go to our website, HCHP, that stands for Hoosiers for a Common Sense Health Plan, hchp.info, I-N-F-O. You can get a little information there. You can contact people and find people to talk to learn a little bit more about this. You can read a little bit more about this. And then I want you to start talking to your neighbors and your friends and your family, people at church, people at work. Start to find your voice a little bit. Speak up a little bit. And then when you're ready, then start to contact your elected representatives. This is old-fashioned democracy. This is the grassroots. We've got the grassroots right here. Let's give a cheer for the grassroots.